Alrighty. Hello to
Hello.
our live attendees and to those watching at a later time on our recording. My name is Pearl Polito. I am a clinical intern here at Allow Health. And I'm joined by Dr. Marybeth Heather, who is the CEO and clinical director. So we're going to take some time to introduce ourselves first and then jump into our topic for today, which is mental health in the workplace. We're going to talk about how those two things coexist in our world and in different aspects and get into it. Oh, there we go. Come on, slides. So just a brief introduction, a little bit about us. That is me over on the left-hand side with my two lovely golden doodles, Shadow and Louie. And something I've recently started doing that has been really important to my self-care and just my, relaxation and being a person, has a lot going on, having a place to just kind of relax is crochet. That is how I've been relaxing for the last few months. And so this is a sweater that I finished in the last couple weeks that I was really proud of. So that's a little bit about me and what I like to do. And I'll hand it over to Dr. Heather to give her introduction.
Yes, hello. So my name is Dr. Marybeth Heather. I am a licensed clinical professional counselor in Maryland. I am also a counselor educator and speaker. So here you have a picture of me with a little balloon flamingo from a recent conference I was at for the American Counseling Association in Orlando, which was awesome. It was great to present there as well. This is my sweet little girl, Mel. She is the epitome of an orange cat, and she is like Garfield's cousin who will eat anything. I have never met a cat who just eats everything. Everything. And this is no, Murphy, not so much. This is my dog Murphy during his winter look before he got his spring cut. You can't even see his eyes because his hair was so fuzzy. And then at the bottom here, recently I went to Sedona, Arizona. So this is from, I believe it's called Merry-Go-Round is what they were telling me. Ooh. So that's the name of this like point area here. Apparently they used to attach the wagons in a circle, so they call it merry-go-round. Oh. So if you're looking on a map, that's where that is from. I went on a tour up there, which is such a beautiful place and beautiful views as part of my self-care to take a break when all my students were on spring break. Yes. Like, I'm going to do something this year.
Yes, absolutely.
Get out there.
Oh, that's such a cool picture. And also, I forgot to mention that I'm currently, a student at Northwestern University working to get my master's in clinical mental health counseling. So that is, why I'm here, getting my hours and working as a clinical intern, which is so amazing.
Awesome.
All right. So, quick agenda for today. We're going to talk a little bit about mental health and its impact on our work. Then get into some of those common mental health challenges that we do see in the workplace. Talk some more about mental health policies and legal rights, a little bit about our federal government and how that has a place in, how our mental health is governed and the resources that we have. Then we're going to talk about some strategies for managing our mental health in the workplace, both from a, leader or employer perspective and also from an employee, teammate, team member perspective as well. Addressing the stigma around mental health at work, and we have some resources for you as well. We'll get into that. So, mental health, how does it impact our work? So, something I found that I thought was very interesting was that unresolved depression can account for a 35% decrease in productivity at work, which contributes to a loss of $210.5 billion a year to the U.S. economy. So not only is it, having such an impact on ourselves and the people around us, can greatly impact, our society at, a economy level, which I just thought was, in our capitalistic society, reason enough for our workplaces to incorporate mental health well-being. Um, and anxiety and chronic illness can also prevent employees from fully showing up at work. So it can lead to reduced effectiveness in their role and possibly costly mistakes. And by what we mean by fully showing up is not, feeling like they're being their full selves at work or not bringing their full selves. They're kind of coming into work and not really focused and not able to, kind of sit down and be productive. They're not fully showing up. They're there physically, but maybe not mentally. Poor mental health can also affect our creative efforts and our ability to make decisions and solve problems. So depending, what your role is and what you do at work, that can be really detrimental to, how you're getting your work done and how you're collaborating with your teams. Poor mental health can also affect our relationships with coworkers, therefore it can affect our collaboration and effort there. And then I wanted to include a term that you may have heard of before, which is called burnout, which we'll talk about too later on, which is defined as this state of emotional, physical, and mental just exhaustion caused by prolonged or excessive stress, which is often related to work. People can experience burnout in different areas of their life, but it's a lot of the times contributed to burnout from their workplace environment or such like that. So what are the common challenges that we see when talking about our mental health and how that comes into the workplace? Anxiety, depression, stress, burnout, like we just talked about, also substance use disorders, and other mental conditions can all manifest because of challenges in our work environments. And we listed some of the factors here that can contribute to all of these, which could be, an excessive workload, not having that work-life balance, long hours, again, that goes with that work-life balance, lack of control or autonomy at work, unsafe or poor conditions, poor communication, or an unfavorable culture. So maybe a culture that's not accepting of all people or not accepting of you as a person, and having to go in and work in that culture that can, really take a toll on someone's mental health. Absolutely. So what are some mental health policies that aid mental health in the workplace environment in our country? So the ones I have listed here, these are all federal laws that are in place. So first off is the Mental Health and Substance Use Disorder Parity, which is a federal law that protects employees' mental health and substance use disorder benefits compared to medical and surgical benefits as well. So it gives them, the importance and the significance that they need alongside medical healthcare as well. The ADA, which is the Americans with Disabilities Act, is a federal law that prohibits discrimination against individuals with disabilities in various aspects of public life, not only in work environment, sometimes in different, public spaces as well. But again, the workplace is included in that. EAPs, which are employee assistant programs. These are workplace benefits that provide confidential and professional assistance to employees facing personal or work-related problems. They're designed to help employees address issues that might negatively impact their work or lives, such as stress, substance abuse, family problems, or financial difficulties as well.
And oftentimes, Pearl, what we want to consider is your employer may have some documents that you're going to need to fill out.
Yeah.
You're going to need a trusted professional, whether it's a counselor, or a psychiatrist, nurse practitioner, or even your primary care doctor to be able to fill out some of these forms to assist you. Sometimes they do require a little bit of documentation follow-up,
Yes.
which may feel evasive, right? So be aware of what's going to be required and seek professional support to get it approved and get the support you need. Employee assistance programs are often very private, right? So you can sign up without, like, as long as your employer has one, you could sign up and use the service even without your employer or your supervisor knowing. So Allow Health is in network with a few employee assistance programs and even FMLA. So Maryland specifically does have some additional laws that are out. So if you are watching this and you live in Maryland, just look for the changes in the Maryland law that are coming up, because FMLA is getting expanded in the sense of support and just legal documentation around it, which gets complicated. And then you're like, I don't feel well, and I have to learn how to do this.
Yeah, it can be a lot to even just, search for that help you need. So that's really good. Yeah.
Yeah.
So I also want to include some information about how our current administration is affecting mental health in our workplaces, and how it's affecting some of those laws that I just kind of touched on as well. So President Trump has actually revoked $11.4 billion in funding for grants that are linked to helping Americans with addiction and mental health. So this is going to cause, this is going to have really negative impact. It's going to cause mental health clinics to close. It's going to cause treatment disruptions for many individuals across the country. And that's also going to cause layoffs as well, across the country in those different hospitals and clinics that are being funded by these grants in the past. The administration currently is also terminated DEI initiatives in all government agencies. And what's really unfortunate is that many private companies are following that. So that's, creating a really negative culture in many workplaces that, especially for people of color, is going to really negatively impact individuals' mental health in those spaces when you're having to work in a culture that doesn't recognize diversity, equity, and inclusion. Trump is also planning to merge the Substance Abuse and Mental Health Services Administration into a new organization, which will end up cutting the funding that's aimed at reducing drug use and overdose deaths in the U.S. And the Affordable Care Act. Trump and the administration also have a goal of dismantling the Affordable Care Act without any plan to replace it as of right now. They haven't given their plan to replace it, so we don't really know what that would be or what that looks like. But this would mean that many Americans would lose their access not only to their health care, but their physical health care, but also their mental health care. And just a little bit more about what the ACA has done. It has successfully reduced the country's uninsured rate to 8.2% from its previous 15% in 2013. So that's, pretty significant. And so, my hope and our hope is that, we don't see that percentage rise. But of course, if something happens to the ACA, we may see that shift happen again. So
I see, Pearl, we have a question back on that side. So I think the answer is the plans are not in place. That's the answer, right? The question is, what are the plans to come into place when they go away?
That's exactly
And there is no plan at this time. The plan is removal and dismantle. The plan has not been shared. I think from our understanding, there's some broad stroke comments about it. However, no direct content.
Yeah.
Which is alarming for us, right? As counselors, for sure.
Absolutely. Yeah. I think there's been some promises made, but we don't really know what we haven't had a concrete plan. Exactly. Oh, where's my slide? There we go. So let's talk about some strategies for managing our mental health in the workplace. Again, these are some for if you're a leader of a team in your workplace, these are good for you. Also, if you're an employee or a team member, these could be good for you as well to maybe, take upon yourself or also advocate to your leaders of why this is so important. So leaders and team members can really work together to foster, a sense of belonging in the work environment. Some ways to achieve this could be to encourage open communication, using more inclusive language and accessible technology, and also empowering team members in decision-making processes is super important. Making sure they're part of those big conversations that, are contributing to, the business or the firm, wherever you are working. Having those people, having individuals included in that process is really important to kind of give meaning to their work and boost their confidence as well, and show that they, really have a meaning there and a big part to their team. It's also really important to recognize that people of color are going to face different challenges in the workplace environment. Language and cultural barriers can be deterrents for people of color. That's why active listening and respecting cultural differences are so important. And those are really the first steps in making your workplace a safe environment for your peers of color. And leaders can also work to really implement flexible work arrangements that can help alleviate stress and prevent burnout, whether that be work from home days or, flexible hours. If it's hard to, for your schedule to work from 9 to 5, maybe 8 to 4, having that flexibility, having that availability can be really important. And I think that's especially important for people who have disabilities or are also neurodivergent as well. A couple more strategies here. Prioritizing self-care and encouraging your leaders to do the same. Time management, having healthy boundaries, and taking breaks are crucial. I mean, taking breaks and setting those boundaries are about just as important as, having that productive time to get your work done. That allows you to have that balance. And if you encourage your leaders to do the same, people are going to feel more comfortable prioritizing their self-care in the office or wherever it is that you do work. Practicing mindfulness and relaxation techniques, so meditation or deep breathing. As a leader, it may be also beneficial to offer these to your team and do them together as a group. I know I've had experiences when I worked in a corporate office where we would have scheduled yoga sessions on Zoom. We had one time, this was during COVID, we had someone who worked at a petting zoo or a farm. They went on Zoom with us and we all got to look at like baby goats and pigs, and it was just like, it was very sweet and very cute, especially during, the pandemic, which was very stressful for many reasons. So there's, all sorts of things that, can be done as a group, both in person or on Zoom that can, offer these relaxation times or these mindfulness times. And then also, we want to try to identify early warning signs of mental health issues, either in yourself, your employees, or your team members, whether you're a leader or an employee. And this can really help an individual seek the help they need sooner rather than later and avoid burnout, right? So what are some of those early warning signs? We want to list them here so they're kind of easy to recognize. So irritability, emotional outbursts, passive death wishes, which could sound like something like, oh, I just, really just hate my life, or I wish I didn't get up this morning, things that are not actually, maybe suicide ideation, but kind of just like, I'm not feeling, great about. Yeah.
You might walk too close to the edge of the sidewalk and say, oh, if a car hit me, this will be it.
Yeah. It could often be like a dark humor comment, I think, sometimes too, right? Yeah.
Yeah.
Increased sadness or dread. Maybe they're leaving work early or arriving late, which if that's unusual to them, that might be a warning sign, right? Not taking part in team bonding opportunities. So if there's, opportunities that, you're going to a happy hour or you're having a party, in the office or something, and they're, not attending when usually that would be something they would do, that could be something that is unusual, right? Anxious behavior, isolating themselves, decreased productivity, increased caffeine usage can definitely be, you know, an early warning sign of something, and even drug experimentation. You know, these are all signs that maybe something is not right with this person and we need to, you know, maybe seek help for them or ourselves if we're realizing these signs in ourselves as well, right?
Yeah, it's tricky because even like the isolation piece, it might not be like traditional isolation from everybody. Maybe you're just noticing someone isn't interacting with everybody the same that they used to. Maybe instead of eating dinner with everybody, your partner goes into the other room, or someone stops eating lunch with the team like they did if you all are in person. Virtually, maybe someone turns off their camera during meetings, right? When they used to leave it on. There can be little kinds of ways that you can see that, whether you're in person or virtual, for sure.
Absolutely. Absolutely. Yeah, and I wanted to touch on this term called psychological safety, which is the belief that one will not be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes, and that the team is safe for interpersonal risk taking. Psychological safety really is critical to workplace culture. It's, you know, it is vital to not only have that physical safety, but also this psychological safety. You know, it's really just as important. And having a psychologically safe environment reduces mental health stigma and encourages individuals to share ideas and learn new skills. Again, you know, some memories from me working in a corporate environment, we had you know, we had really great seminars about psychological safety. And even, you know, before big meetings with, you know, the whole team or the whole, you know, organization, we would touch on psychological safety before we got started with the meeting, just as a reminder, like, hey, this is a psychologically safe place. We want you to come with your ideas, your concerns, your questions. You know, you're not going to be judged. So that was really pushed in the environment that I worked in the corporate space, and I thought that was really, really great and something that I, you know, think needs to be seen more across, you know, other companies and work environments as well. But yeah, psychological safety is really, really vital, I think, in my opinion. And so touched on a little bit on, you know, having that psychologically safe environment, you know, really is addressing that stigma. We want to be able to address that stigma, that mental health stigma in our workplace environment to create that safe environment, right? So how do we do that? First of all, we don't ignore it, right? We recognize and we challenge it. We further foster that sense of belonging and that culture of openness, that you will not be judged if you know, come to us with questions or ideas, you know, share personal stories of overcoming mental health issues, you know, when appropriate, you know, allowing that space to bring your humanness to work, right? Allowing others to share those stories, I think is such a really great idea. And I think people are afraid to do in their work environments a lot of the times. And so just about creating that openness culture can allow people to feel more comfortable doing that. Encouraging peer support and engagement. And again, like I said before, have meetings, webinars about mental health with the team, about psychological safety. Address it, you know, even when the meeting's not about that. Say, you know, we're starting this session, we're going to talk about this, but want to remind you all that we are a safe place. We can share ideas here, right? And make it known that our physical and mental health are equally important. I think this is so, so important. Physical health, I think sometimes in our work environments really will outweigh that mental health support. And I think something that leaders can do here is make it normal to take a mental health day, right? I think that's really important, not, you know, shut someone down for doing that, because it really is equally as important as our physical health, right?
And sometimes mental health day is scheduling fun stuff to do too,
Yeah.
right?
Yeah.
Being aware that your hobbies, your time with others. There's different, like right now, it's different seasons are coming up. And think about all the sporting events that are coming up, right?
Yeah.
Lots of different sports coming up, whether that's baseball or I know our hockey fans are losing their minds in DC right now with all the records being broken. You know, taking those time, like, do you need to take off even to attend the night before? Do you need to take off the next day?
Yeah,
So many of us go to an event and then like up till midnight, you can't go to work at
no.
early AM and be functional. Go have some fun. Use your time off. Flex your time if your boss allows you to.
Absolutely.
Communicate your needs.
Yes. Yes, that is so important. Communicating our needs, right? So finally, we included some resources here, some national resources, National Alliance on Mental Health Illness, the 988 number, which is our new federal suicide and crisis lifeline, which is nationwide. Substance Abuse and Mental Health Services Administration. Also included the Calm app and Headspace on here. The company that I used to work for actually had an affiliation with Calm. And so as an employee, I had access to it. So if you're a leader and you're looking for ways to promote mindfulness, that's a great way to do it. You know, offering something like this for your employees so they have it. We also in my old office would have rooms where you could schedule time and it was a closed room, no windows. You just go in, you can meditate, you can do yoga. Having that space to just take a break from the day, whether it be 15, 20 minutes, right? Headspace is a similar app to Calm, offering guided meditations and such like that. Also have some Maryland specific resources here for career development and workforce development, adult learning, and their phone numbers are included here as well. And then additional crisis hotlines for Maryland. Wanted to make sure we're including those. So these are, you know, based on, you know, what county you are in. But again, we do have that 988 number, which is a national lifeline.
And keep in mind, some of these do text as well. So if you're not a
Yes.
talk person, definitely consider texting. I will say that some people feel that the text feels kind of like a robot. However, from my understanding, it is a real person. They're probably just working off of a prompt. You're not getting AI'd all the way. You know, it's tricky these days with so much technology coming out.
Yeah, right. I know. It's hard to tell what's real, but it is real. These are real people. They are real people. And yeah, I just want to include how to reach us at Allow Health. We have our email, website, phone number here. If you or someone you know is looking for mental health care, we have myself, Dr. Heather, and another clinical intern on Yoma as well, who are open to taking clients. So we'd love to hear from you. But yeah, I think that was all for today.
And for those who might be experiencing transition in the workplace or insurance changes, I'd always keep in mind that we do have a few pro bono spots that are open with our students, as well as do offer sliding scale. So if you have something and you're like, oh, I can't do it, just know that there are additional options that you might not have thought about, even if it's short term. Just having a few sessions to kind of recalibrate can be so key, right?
Absolutely.
And when you first meet us, it's a free 15-minute consultation. So you don't have to commit, right? You can be like, oh, they're cool or not. Come meet us and see if we can support you. It's tricky. There's so many changes going on in the community right now with all these executive orders and workplaces restructuring, changes in DEI. So as Allow Health is, we really promote diversity and are very inclusive environment. So definitely reach out or contact us if you have questions or even would like us to come talk to your teams too about all of this.
Absolutely. Yeah.
All right. Any other things you want to add, Pearl, before we stop?
I don't think so. I think that's about it. But
All
I
right.
thank you all for listening and watching the recording if that's what you're doing as well. So, yeah, great.
Good
Thank you.
luck for those job seekers out there and
Yeah,
for those folks who may be in a workplace environment that's not feeling so
yeah,
healthy. You're going to make it.
you
You're
are.
going to
You are.
make it. Just remember those 1 to 10% little changes, even thinking about change shows that you're in the more of the contemplation stage, the getting towards that action, right?
Absolutely.
All right. Be safe, everyone.
All right. Bye.
Bye.